And this session we're going to the electrotherapy, and this is the second sessions. In previous class we're going to discuss about the Faraday current and its descriptions, and now we're going to describe about the what are the other type of the currents were located in our low frequency and medium frequency. So basically what are the branches of the low frequency and medium frequency we're going to discuss now. The branches of the low frequency and medium frequencies are the treatment part, and diagnostic part, and diagnostic part. So in our electrotherapy one session, that is the combined portion of low frequency and medium frequency, right? So this is the Faraday current we already discussed, so we'll skip now. So the next currents are galvanic, diadynamic currents, iontophoresis, sinusoidal current, high voltage pulsed galvanic current, and tense Russian current IFT. So these are all the treatment purpose of this current. So in this treatment part, we again go divided into LF currents and MF currents, which is nothing but the low frequency currents and medium frequency currents. So here the Russian currents and IFT currents are the only two currents are comes under the medium frequency currents. These frequencies were more than the 1000 to 10,000 hertz. So that's why which is resembles to the two currents are comes under the medium frequency currents. The remaining tense iontophoresis, sinusoidal, high voltage pulsed galvanic current, diadynamic current, galvanic and Faraday currents are comes under the low frequency current. Okay, we'll move to the second branch, that is the diagnostic branch. The next diagnostic branch, there are three sub parts comes under the diagnostic part, that is nerve conduction velocity, strength duration curve, and biofeedback. So in these three branches we are going to identify the lesions. So where is the lesions were located into the particular branches of the nerve fibers. So where is the lesion, that is the location of the lesion. Second one, what about the size? The size of the lesions were located in our nerve lesions. So that is the purpose we are going to diagnose into the NCV, SD curve and biofeedback. So these type of the currents where comes under the diagnostic purpose of the currents. So mainly in the three branches we are going to use into the direct current. Direct current or interrupted direct current and otherwise known as galvanic current. Okay, and next. So first of all, coming to the galvanic current. So galvanic current just vice versa to the Faraday current. So what we are going to discuss in our Faraday current, which is the short duration of interrupted unidirectional flow of the low frequency current. So this is the long duration. So Faraday current is the short duration and galvanic current is the long duration, and it's the low frequency interrupted unidirectional direct flow of the current. So here the pulse durations are 100 milliseconds or 600 milliseconds, which is basically manufacturing in our modality, and the treatment purpose we're going to use more than 1 millisecond. So what about the Faraday current, which is the 0.1 to 1 milliseconds. So within the 1 milliseconds only the frequency we are going to use into the Faraday current. So more than 1 milliseconds of the frequencies we are going to use into the galvanic current. Okay, so what about the frequency? This is the low frequency current. So this is the 50 hertz of the frequency, and it's only used for the denervated muscles. denervated muscles because of this depolarized modulations. Okay, we're going to see in the what about the modulations. So the galvanic currents only used for the denervated muscles, and the Faraday currents were going to used for innervated muscles. This is the basic one. So what are the basic types of the muscle based on the nervous supply? That is the innervated and denervated, right? So what is mean by innervation? The branch of nerve supplies properly supplied over the group of muscles were known as innervated muscle fibers. So what is mean by denervated? There is any lesions over the nerve roots to supplied over the particular group of muscle fiber, that is known as denervated muscle fibers. So in these galvanic currents only going to used over the denervated muscle fibers. So the Faraday currents only going to use into the innervated muscle fibers. So what are all the modulations are there basically? So first one, triangular, trapezoidal, short tooth, rectangular and depolarized. So only into the depolarized part of the modulation we're going to use into this type of current over these denervated muscle fibers. Let's discuss about that. So coming to the modulation schematic picture. So here it is the Faraday current, here it is the galvanic current. We're going to compare the Faraday and galvanic current because both the current were formed by the single modality, that is the muscle stimulator. So already seen, Faraday current is the short duration one. So the schematic pictures look like this only. Okay, so what about this galvanic? This is the long duration. So these schematic picture look like this. So this is the 0 point, and this is the intensity of the electrical current, and this is the treatment durations, right? Intensity x-axis and treatment durations are y-axis. So here the durations are too short compared to the galvanic current. So here the durations are more than 1 millisecond. Here the durations are 0.1 to 1 millisecond. So what about the frequency? So both the currents were comes under the low frequency modalities, right? So this is the 50 hertz and this is 30 to 50 hertz of the modality. So what about the modulations? Triangular, trapezoidal, depolarized and short tooth. So coming to the modulations. So first one, triangular. Triangular, trapezoidal, short tooth, depolarized. So coming to the explanation, the triangular one, this is the 0 point, this is the frequency, and this is the duration, pulse durations, right? Once in the triangular period, once the intensity of the electrical currents gradually increase, and once it's touched to the peak level, and which is gradually reduced, okay, and is followed to the off period, and it is gradually increased, touched to the peak level, and it is gradually reduced once it's touched to the zero level. So what about this peak level, which is depends upon the person to person, it will be get changes, depends upon the regulator. So coming to the trapezoidal one. So in this trapezoidal, we're going to increase the intensity now. which is gradually increased, and once it's touched to the peak level, which is maintained some amount of the peak level duration, and it is again gradually get reduced, touch to the zero level. And coming to the short tooth, so once we're going to increase the intensity now, the frequencies are gradually increased, and once it's touched to the peak level, suddenly it's going to get reduced and touch to the zero level. See, this is the short tooth. Comes in the depolarized. So what about depolarized? So in this depolarized only, so this is the polarization state, and this is the repolarization, and this is the depolarization. So in this state only, from the zero to from the positive peak level, which is maintained to the amount of peak level, and it suddenly reduces the zero. So and then it's going to start from the negative peak level. It start to negative peak level of the intensity, and it's maintained to some amount of the negative peak line, and it's again to touch to the zero level. So this is the only mode. Again, compare between the Faraday current or galvanic current. This is the only mode of the frequency repolarization state and the depolarization state of the pulse durations going to supply. So compared to other modality, for example, triangular, trapezoidal, and short tooth, the pulse waveforms only presented into the repolarization state. So this is the only current, this is the only mode going to supply into the repolarization and depolarization state. So that's why in the acute stage of the stroke, we're going to use in this type of the modulation. So once the regenerations once get started, that is the based upon MRC grading from the 0 to first grade, that is the flickering contraction. On the time, we're going to change the mode from here to this type of the modulations, right? So coming to the iontophoresis. So what is mean by iontophoresis, which is otherwise known as drug delivery system? This is otherwise known as drug delivery system. So what is mean by iontophoresis? So here the phorus is nothing but resembles to the penetration. This is the penetration of phoresis. So what is about the iontoph? So ions are resembles to drugs. So that is why otherwise known as drug delivery system. So this is one of the non-invasive method. So what is mean by invasive and non-invasive? So if any other procedures, we are going to disturb the skin and other fascia, we are going to open the skin and open the fascia, means that is the invasive method. So without opening of the skin, that is the treatments where comes under the non-invasive treatment. So most of the techniques where comes under the electrotherapy, all the currents where comes under non-invasive method. So what about the exact definition of this iontophoresis? That is introduction of ions. Ions are nothing but the tablets or drugs, right? So introduction of ions into the body through the skin, because this is the non-invasive method. Through the skin, you are going to insert the human body with the usage of constant direct current. Okay, with the usage of constant direct current. Here we are having the formula, that is I into T into ECE. Here the I resembles the intensity of the electrical current, the intensity of the electrical current, and T's are time duration. Time duration. So what about this ECE? ECEs are nothing but electrochemical equivalent. Electrochemical equivalent. So while we are applying the iontophoresis, this type of the constant direct current and the ionization drugs were commonly used into the equal manner. So what is the basic disadvantages or dangers of the electrotherapy? That is the burns, right? So what is the types of burns? That is the electrical burns or chemical burns. So first one is the electrical and next one is the chemical. Here there is the mismatch over the electrochemical equivalent. For example, electricals were high amount, means that's going to lead into the electrical burns, and chemical drugs were going to increase, mean that leads to chemical burns. Okay, so that is the purpose of I into T into ECE. The next portion, that is the high voltage pulsed galvanic current. So high voltage pulsed galvanic current, that resembles to twin peak monophasic current. The name itself mentioned, that is the twin peak pulsed monophasic current with the voltage of high. With the voltage of high. The name itself mentioned that is the high voltage pulsed galvanic current. This is the one of the branch comes from the galvanic current. High voltages, the voltage limits up to 500 volt. The pulse durations are 200 µs and the interpulse durations are 9800 µs and single pulse duration totally 10,000 µs. So coming to the schematic picture, high voltage pulse duration current. What is the basic definition? This is the twin peak pulsed monophasic current. This is the twin peak. And what about the pulse? The pulsed wave resembles to this resting period. This is known as the pulsed. And this is the twin peak. And this is about the pulse. And what about the monophasic? So this is the polarization state of the level. And this is the repolarization state. And this is the depolarization state. So what is the monophasic? So either repolarized or depolarized state, only the electrical current frequencies were going to get occupied. So that's why this is the monophasic. So what about the pulse duration? The pulse durations are 200 µs and the interpulse durations are interpulse intermittent wave 9800 µs. Okay, so this is the single wave and this is the next portion of the single wave. So totally it's occupied to 10,000 hertz of the 10,000 µs of the pulse duration. So this is the twin peak pulsed monophasic current. There is a pulse that is resembles to off time. That off time durations are 9800 µs and the on time durations are 200 µs. So totally single pulse duration, it will take the time duration of 10,000 µs. This is the consequence of high voltage pulsed galvanic current. Coming to the sinusoidal current. So sinusoidal currents are evenly alternating low frequency currents, right? So sinusoidal current is basically derived from the which type of the current means that is the Faraday current. So what about the Faraday current, which is unevenly alternating current? These sinusoidal currents are evenly alternating current. This evenly alternation is based on the frequency level. These frequencies are based on the repolarization or depolarization. The frequencies are evenly get alternating. If the frequencies get uneven alternation means that is the Faraday current. The sinusoidal currents get the evenly alternating of the low frequency current. The frequencies are mentioned, that is the low level. So that is the level of 50 hertz. So it's provide the 100 pulse duration in a single session. So in the first half, which is the 50 level of the pulses. In our second half, it produces the second 50 level of the hertzes. So totally in a single second, it's provide the 100 amount of the frequencies. So in the first 50 frequencies are comes under the first rectification and the second 50 were comes under the second half of the rectification, that is the sinusoidal current. So I already told what is sinusoidal current, which is evenly alternated, which is basically developed from the Faraday current. So Faraday current is the main support of the current. So from the main supply current, thus unevens based on the frequency level of the hertzes. So this is the Faraday current and this is the sinusoidal current. This is evenly alternated. Okay. Next we'll move on to the diadynamic current, which is otherwise known as Pierre Bernard current. So the Bernards is the only candidate going to produce. That is why which is named as pure Bernard current. So what is the exact definition? These currents are monophasic sinusoidal current. So what is sinusoidal current? Which is evenly alternated low frequency current. In that evenly alternated low frequency current produced from the single phases, that is the monophasic current, that is the diadynamic current. So what are all the modulations of the diadynamic current? So first one, which is the fixed monophase and fixed diphase, short period or Curtis period or modulated long period, syncopal rhythm or modulated monophase. The pulse durations of the fixed monophases are 10 milliseconds. So coming to the schematic picture, fixed monophase, right? So this is the schematic picture for the fixed monophase. The name itself mentioned this is the mono, right? So mono means either the regenerative forces only which is presented into the frequencies level. About this fixed, the frequency levels were going to fix into the level, that is the peak level, which is depends upon the person to person, and the pulse durations are 10 milliseconds. So that is the fixed monophasic current. So what is the next one? That is the fixed diphase. So fixed diphase order pulse durations were 10 millisecond. So coming to the fixed diphase, that name resembles, this is the di. Di means that resembles two phases, right? So this is the diphase, and again going to fix the frequency levels are fixed, depends upon the patient tolerance level. The time durations are 10 milliseconds. So this is the fixed diphase and this is the fixed monophase. The monophase time limitations also 10 milliseconds and diphases order pulse durations also 10 milliseconds. So coming to the short period and long period. The name itself mentioned that is the short period, which is the combination of fixed monophase and fixed diphase, and the long duration also, which is the combination of fixed monophase and fixed diphase. So what about the duration? The duration, fixed monophase and fixed diphase is the combination. The total period is 1 second, that is known as short duration, and modulated long period is the 10 second and 5 second. We're going to discuss. So what is short period? Which is the combination of fixed monophase plus fixed diphase with the duration of 1 second. So fixed monosecond plus fixed diphasic. So totally this is 1 second and this is 1 second from the treatment duration to at the end of the treatment duration, which will be combination of the short fixed monophase and fixed diphase. That is the period of 1 seconds were known as short period. So coming to the modulated long period, there is the modulation over this frequencies level, that is the modulated long period. So totally which is the 5 seconds and 3 seconds of the fixed monophase and fixed diphase. So coming to the fixed diphase picture, plus fixed monophase, the durations get increased. That's why which is mentioned, that is the long period, that is 5 second and 3 second of the combination of fixed monophase and fixed diphase. Based on this duration, it will be comes under the whether it is long period or short period. The next one, syncopal rhythm. So what is about the syncopal rhythm means fixed monophase plus half time. That is the period of 1 second plus 1 second combination. Coming to the syncopal rhythm. This is the combination of 1 second plus 1 second fixed monophase plus resting period. So how it is going to get work? So this is about the fixed monophase. This is 1 second, and the resting period, that is the half period. This is the 1 second period. And again after this 1 second, it's again come to the fixed monophase. That's also 1 second, and followed by the resting period 1 second. From the treatment duration to at the end of the treatment duration, this is the same combinations where routines move on. So this is the syncopal rhythm. So what about the modulated monophase? So modulated monophase plus half time square comes under the modulated monophase. The time durations are 4 second to 5 second. Coming to modulated monophase. So modulated monophase plus resting periods were known as modulated monophase. The name itself is going to get modulation of the frequencies. So what about the monophase? This is the single phase where comes under the resting period. The frequencies are going to get altered. This is 4 seconds plus resting periods are 3 seconds. So this is why the combinations where comes under the modulated monophases. So once again I'll repeat. So what are all the modulations are there? Fixed monophase, fixed diphase, short period or courtesy period, modulated long period, syncopal rhythm, and modulated monophase. Clear? So this is about the diadynamic currents. So comes to the TINs. So TINs are transcutaneous electrical nervous stimulation. It's a simple non-invasive method. So mostly all the electrotherapy modalities where comes under the non-invasive technique only. It's produced the low frequency current in the form of rectangular. So what is meant by rectangular shape? So this is about the rectangular, right? So this is about the rectangular shape, and the pulse durations are 50 to 200 ms. So this is about the duration. The pulse durations are 50 to 200 ms, and the frequencies are, and these frequencies are 1 to 120 milliampere. 1 to 120 milliampere. This is the basic schematic pictures of the TINs. So what about the waveform? The waveform is the biphasic. So this is not a uniphasic or monophasic. This is the biphasic waveform. This is the biphasic rectangular shape of the waveform, which is either the symmetrical or asymmetrical. So what is meant by symmetrical? This is the shape of symmetrical shape of the TINs, and this is the asymmetrical shape of the TINs. So whether it is the symmetrical or asymmetrical, and it is balanced. So what about balance? That balance where resembles to the pulse durations. Thus the same amount of the balance were maintained whether it is the symmetrical or asymmetrical. That pulse durations are 50 to 200 ms. Clear? Next, coming to the types. There are 4 types. First one, conventional TINs. Conventional TINs were otherwise known as high TINs, plus acupuncture TINs or acutins or low TINs, which is otherwise known as low TINs. So what about the high and low? The high and lows were resembles to the frequency level of the conventional and acupuncture type of the TINs. So here in under the conventional TINs, the frequency level is high and the intensity level is low. That is why the conventional TINs were otherwise known as high TINs. So here the acupuncture type of the TINs, the frequency levels are low and the intensity levels are high. Just vice versa to the conventional and acupuncture type of the TINs. So under the conventional TINs, the frequencies are 50 to 100 pps. Pps were nothing but the pulse per second. Here the duration 2 to 50 milliseconds. That is the conventional TENS. Come to the acupuncture. So acupunctures are frequencies 1 to 5 pulse per second and the durations are 150 to 300 milliseconds. The third type, that is the brief intense TENS, and next one burst modulation TENS. So brief intense TENS order frequency 80 to 150 pulse per second and the durations are 50 to 250 millisecond. And the burst modulation, the frequency levels are 50 to 100 pulse per second and the durations are 50 to 200 millisecond. So this is about the TENS. So coming to the medium frequency current. So in our low frequency current, what are all the currents we are going to discuss till now? So first one, it is the galvanic current. So what is galvanic current? This is the long duration of interrupted low frequency unidirectional current. This is the short duration of interrupted unidirectional current. So what about the diadynamic current, which is the modulation of plus unipole of the sinusoidal currents were known as diadynamic current. So what about the sinusoidal current, which is evenly alternated currents were known as sinusoidal current. The Faradics are unevenly alternated and the modulation of the sinusoidal currents were known as the diadynamic current. And what about the high voltage pulsed galvanic current, which is the twin peak pulsed monophasic current, The pulse durations were known as 200 µs and interpulse intermittents were 9800 µs, right? Plus 10s. So these currents comes under the low frequency currents. So hereafter the Russian current and IFTs were comes under the medium frequency currents. So coming to the medium frequency currents. So coming to the medium frequency currents. So in our medium frequency currents, there are three currents totally. First one, Russian current. Next one, Rheobase current. And the next one, IFT. These three branches were comes under the medium frequency current because these three currents were frequency levels were 10,000 hertz and in between to 1000 hertz. 1000 to 10,000 hertz of the frequencies were comes under the Russian Rheobase and IFT. So coming to the Russian current, which is otherwise known as Yakov code current, the evenly alternating current with the frequencies are 2500 hertz or 2.5 kilohertz. These evenly alternated current were resembles to sinusoidal current also, because the sinusoidal currents also evenly alternating current. In the Russian currents also evenly alternating current. So what is the main differentiation means? That is the frequency level. Here it is the 2500 hertz and there it is to the 50 hertz. 50 hertz plus evenly alternated means that is the sinusoidal current, plus 2500 hertz plus evenly alternation means that is the Russian current or Yakov code current. And the pulse durations are 20 milliseconds and first 10 milliseconds are on period and second 10 milliseconds are off period. So this is about the Russian current. Next one, IFT. The IFT currents were otherwise known as Nimek current. There are two medium frequency currents are join and cross across to the tissue to produce as a low frequency effect that is based upon the beat frequency level. So here we are going to use 4 electrode, that is anode and cathode, 2 anode and 2 cathode electrodes. So anode is the red in color plus positive charge. We are just placed across opposite direction. This is the anode plus red in color plus positive charge. Just opposite vice versa, we are going to place the opposite channel. This is the cathode plus black in color plus negative charge. This is the cathode black in color plus negative charge. So we are going to visible whether it is the vertical or horizontal. In this manner, we are going to either the negative positive and negative positive. Here also, which is look like the vice versa period of the schemic, and here also, which is the vice versa of the modulation. So that's why the currents were easily passed out. So what about the beat frequency? So I already told IFTs are the medium frequency current. Medium frequency currents are 100 to 10,000 hertz of the frequencies. So for example, here we are going to take the 4,000 hertz of the frequencies. So this is the central point of the muscles or tissues. So in every electrode which is presented into the 4,000 hertz of the electrode. So once we are going to start the intensity knob, the electrical currents were started and processing and moving each other. Once it's touched to the middle level, some amount of the frequencies getting burst out. Depends upon the principles of the medium frequency current. So what are all the principles of medium frequency currents? That is the observation, reflection, rarefaction, and destroy or eliminator. Right. So based upon this, so already which is the 4,000 hertz of the frequency, some amount of the currents were get absorbed based upon the muscle tolerance. Some amount of the electrical currents were get absorbed. So balance amount of the current intensities were getting burst out based on the reflections, right? So that is the 100 hertz of the frequencies were getting eliminated. So only 3,900 hertz of the frequencies absorbed by the muscles. So that is the portions of beat frequency. So based on this beat frequency, 2 medium frequency currents were crossing to the muscle tissue and producing as the low frequency effect. So that is the IFT, which is otherwise known as Nimet current. So that's about the treatment part. So in our treatment part, that is the 2 portion. That is the low frequency and medium frequency. In our medium frequency, that is the Rheobase current, Russian current, and IFT. So Rheobase were nothing but the some amount of the electrical current which is start from the Rheobase setup unit. That is known as the Rheobase current. Russian current, which is the 2,500 hertz of the medium frequency and evenly alternated sinusoidal current, and IFT, 2 medium frequency currents joined together to produce as a low frequency effect. So coming to the diagnostic part, the first one, it is the nerve conduction study. So in our nerve conduction study, we're going to divide it into the 2 parts, that is the motor nerve conduction study and sensory nerve conduction study. So under the motor nerve conduction study, we want to know about compound muscle action potential. So under the sensory nerve conduction study, we want to know about the SNAP. That is nothing but sensory nerve action potential. So what is mean by compound muscle action potential and what is mean by sensory nerve action potential? Yes. So coming to the motor nerve conduction study, here we want to know about the compound muscle action potential. So in this motor nerve conduction study, first we want to know the principle and second the procedure. So what is the major principle? First, we want to ensure the supramaximal stimulation of the particular muscle. So how are you going to stimulate the supramaximal stimulation? Based on the cathodes were closely attached to the active record electrode. Active recordings were nothing but anode. So here the anode cathodes were more closely attached to stimulate the supramaximal stimulations, which going to prevent the hyperpolarization of the anode and anodal conduction block. So what is mean by hyperpolarization of the anode? So this is the normal pole structure, and this is the hyperpolarization. So one wave is the normal pole, and followed by the next waves were going to very high peak level. So that is the hyperpolarization state. Here we are going to attach more closely with the anode and cathode, which is going to prevent the hyperpolarization of the anode, and next one is the which is going to block the anodal conduction. So for these two reasons, we are going to closely attach with the anode and cathode. This is the basic principle. So coming to the placement of electrode. So in our treatment part, we are going to mention that is 2 point of the electrode, that is anode and cathode. But in our diagnostic purpose, we are going to use into the recording electrode, active electrode, ground electrode, and reference electrode. So what about the recording electrode, which is going to record our electrical muscle activity to the graphical sheet? So that is the name as recording electrode. So where we are going to insert this recording electrode, that is the belly tendon montage. So coming to the active electrode, as we all know, active electrodes were placed over the motor point of the muscle. And next one, ground electrode. Ground electrodes were placed in between the stimulating electrode and recording electrode. Here the stimulating electrodes were nothing but the active electrode. So the ground electrodes were placed in between the active electrode and reference electrode. Okay. Then reference electrode, where we are going to place, that is the belly of the tendon, muscle tendon we are going to apply. So this is the principles of motor nerve conduction study. So coming to the sensory nerve conduction study. So in the sensory nerve conduction, we want to know about the SNAP, sensory nerve action potential. So how we going to identify the SNAP? That is based on the orthodromic and antidromic manner. So what is antidromic? What is orthodromic? So orthodromics are nothing but we are going to stimulate the nerve over the distally. We are going to stimulate the nerve distally, and the SNAP, sensory nerve action potentials, were recorded into the proximal part, right? So I repeat once again. So in orthopedic manner, we are going to stimulate the nerve with the distal part and recorded the SNAP over the proximal part. That is known as the orthodromic. And what about the antidromic? So antidromics were nothing but just vice versa to the orthodromic. So we are going to stimulate the nerve over the proximal point, and we're going to record the SNAP over the distal point. That is known as the antidromic. That is the combination of orthodromic and antidromic. That is the portion to identifying the sensory nerve action potential. So coming to the measurement, how we going to measure the lesions were presented or not, and which size of the lesions were located or not. Okay, the first one, onset latency, duration, and amplitude. So what is mean by latency? So in our normal muscle, to getting the normal innervation means, so when we are going to increase the intensity knob over the 0, the next to 0 is the 0.1, 0.2, 0.3, like that, 0.1, 0.2, and 0.3. If that is the muscle get normal nerve innervation means, once we are going to starting the intensity knob increases, so automatically the muscle is going to get contracted from the level of 0.1. So if there is a lesion means, which get some period to get muscle get contraction. Okay. So in this period, we can't get any muscle contraction because of the lesions were located where we are going to the treatment part. This is the normal portion and this is the lesion portions. So the difference between the normal and lesions are, once we get the start over the intensity knob to the 0, the muscle contractions were flickering at the level of 0.1. That is the normal one. The abnormal one is the once we are getting the intensity knob increases from the 0 to 0.1 based upon the lesion size, it will be increases to the muscle contraction level. Okay, that is maybe 0.5 or 0.6 level. That is depends upon the size of the lesion. So these periods were known as the onset latency period. Latency periods are nothing but the it's a gap or inter between the portion of increase the intensity knob plus muscle contraction period. That is the portions for latency period. So in this latency we have two types, that is the proximal latency plus distal latency. In this proximal portions of the latency period and distal portions of the latency period. Latency periods were nothing but the time and in between the portions of increasing the intensity knob and the muscle contractions get flickering. In between the portion, that is the distance and that is based on the lesion or size. Okay, that is the onset latency. So coming to the duration. So what is duration? So this is about the duration. The horizontal level is where known as the duration. So how we are going to calculate the duration? Yes. So this is the base level and this is the peak level and this is the positive peak level and this is the negative peak level. So we are going to identify that is the duration. So from the baseline to peak line is one of the duration calculation in this period. From the baseline to negative peak line, which is the second most duration calculation. The third one from the baseline to next baseline, which is known as the third identifications of the duration. So here we are going to treat the three portions of the duration. So first one, the duration from the starting to peak level of the positive one. So this is the positive charge. So this is the peak level. From the starting portion to mid level of the peak level is the first portion of the duration. The second portion from the baseline to, which is 0 to the negative peak level. This is the second method of the duration. And the third method, which is start from the baseline to baseline. From the 0 to again it comes to the 0 level. It is the third portions of the duration. So totally three types of the durations are there. So what is that? 0 level to positive peak line, 0 level to negative peak line, and 0 level to 0 level. That is baseline to baseline level. So this is the identifications of duration. So coming to the amplitude. So what is meant by amplitude? That is the vertical frequency levels where resembles to the amplitude. So this is duration and this is the amplitude or frequency. So how we are going to calculate the amplitude? So based on the duration level, so this is the first amplitude, second and third amplitude. That is calculated. This is the baseline and this is the peak line. Baselines are otherwise known as 0 and the peak levels are depends upon the patient tolerance. The first level of the amplitude from the baseline to positive peak line of the level. This is the first amplitude. The second amplitude from the baseline to negative peak line of the levels where comes under the second amplitude. The third amplitude from the peak level to peak level. The positive peak level to negative peak levels where comes under the third portions of the amplitude. So this type we are going to measure the lesions were presented or not based on the latency period, duration or amplitude. So what about the formula of the nerve conduction study measurement? That is the D bar PL minus DL. That D resembles to distance between the anode and cathode, that is the D. PL resembles to proximal latency and DL that resembles to distal latency. So based on this latency period, whether it is the proximal or distal, and the distance between the anode and cathode. So those are all the calculating period. The formulas are P divided by PL minus DL. That D resembles to the distance. This is the proximal latency and this is the distal latency. This is the calculating formula of the nerve conduction velocity. So coming to the SD curve. So SD curves were resembles to strength and duration curve. So what is mean by strength and duration curve? Which is the graphical representation. This is the graphical representation and the correlations between the intensity of the electrical current and the time it will take to the minimal muscle contractions were known as strength duration curve. So basically this is the x-axis, this is the y-axis. This x-axis was the resembles to strength. This y-axis is resembles to the duration. This is the duration and this is the strength. Strength where resembles to the intensity of the electrical current and the durations where resembles to the time it will take to the muscle to get the minimal amount of muscle contractions. The graphical correlations between the strength of the intensity of the electrical current and duration it will take the minimal contractions were known as the SD curve. So SD curves, so basically three types, that is normal innervation. So what is meant by innervation? There is a proper nerve supply over the muscle groups were known as normal innervation. And next one, complete denervation. So what is meant by denervation? There is no proper nerve supply over the group of muscles were known as denervation, that is completely arrested. The third one, partially denervated. So in a group of muscles, some branch of nerves were properly supplied and some branch of nerves were improperly supplied, that is the known as partial denervation. So normal innervation, that is the nerve curve. So how it is going to get work? So first we are going to discuss the normal innervation. This is the x-axis. X-axis were otherwise known as strength. And this is the y-axis. Y-axis were otherwise known as duration. The strength were resembles to the intensity of the electrical current and the durations were resembles to the time it will be take to the minimal amount of muscle contraction. This is the combination of graphical representations were known as the strength duration curve. The first one, normal innervation. So how it is going to start? So this is the zero level. So when we are going to start the intensity knob, the muscle contractions were going to get flickering. So this is the basement line. So once is to elevate at the level of 1 millisecond. That is the normal innervation. If the nerve groups were properly supplied over the group of muscle, means the intensity were going to increase from the 0 to 0.1, 0.2. At the level of 1 millisecond, the muscles were going to get contracted, means that is the normal innervation level, which is otherwise known as nerve curve, because the branch of nerves were properly supplied to the particular group of muscles. That's why which is mentioned nerve curve. So next one, which is the complete denervations. So complete denervation means there is no proper nerve supply over the muscle, which means this is the x-axis and strength and this is the y-axis and durations. So the curves look like steep and which is totally shifted to the right side of the graph. So from the graph side portion, there is the angles not look like this. So totally it will shifted to the corner of the portions because there is no single nerve fibers were supplied to the group of muscle. So that's why which is known as the muscle curve, which is steeped curve. S-T-E-A-P-E-D, steeped curve. The next one, partial denervation. Partial denervation means some amount of the nerve supplies were properly intact and some amount of the nerve groups were improperly intact. That curves look like this. This is the proper supply of the nerve fibers over the muscle, which is improper supply over the muscle group. So this is known as kink curve. Okay. So what is the basic physics behind the SD curve? That is the Rheobase and Chronaxie. That is the Rheobase and Chronaxie. So what is Rheobase and what is Chronaxie? Rheobase is resembles to the minimal amount of the currents were produced to flickering the muscle contraction. So this is the strength and this is the duration. So what we are going to discuss in the normal innervation at the level of 1 millisecond, we are going to see in the muscle contraction. So the baseline to peak level, once it gets started over the peak level, that level is 1 millisecond means that is the normal innervation. So what is Rheobase? The minimal amount, these amounts were going to get reduced. The minimal amount of the intensity of the electrical current we are going to produce the flickering muscle contractions are less than 1 millisecond, less than 0.01, 0.001, like that. In this manner, the muscles are going to get contracted, means that is the Rheobase. So what is meant by Chronaxie? The twice the Rheobase were known as the Chronaxie. So if there is the Rheobase means the same amount we are going to calculate it. This is about the Chronaxie period. This is the Chronaxie and this is the Rheobase. So what is Rheobase? The minimal amount of the intensity, the minimal amount of the intensity is required to producing the muscle contractions were known as the second. So under the Rheobase, which is going to reduce the 1 millisecond, whether it is the 0.01 or 0.001 or minus 1 millisecond. So whatever the amount of the durations, the muscles are going to get flickering. So that is known as Rheobase. This is the Rheobase level. So what about the Chronaxie? The twice the Rheobase is were known as Chronaxie. The same amount we are going to get calculated here, and the same amount we are going to mark into the graphical sheet. The both the currents were known as Chronaxie pair. So these values were known as Chronaxie and these values were known as Rheobase. Clear? And next we'll move on to the question. So during the nerve conduction study, the latency periods were refers to what? So I already told. So here we are going to increase the intensity knob, but the muscle contractions where we are going to see here only, because the lesion, the muscle contractions were going to get distracted. So this is the latency period, the time interval between the stimulating period and response period is the correct answer, right? So coming to the second question, what does the prolonged latency in the nerve conduction study suggest? So nerve conduction period வந்து prolonged இருக்கு அப்படினு பார்த்தோம்னா அதுக்கு என்ன ரீசனா இருக்கு அப்படினு பார்த்தோம்னா first one normal curve function. So normal nerve function இருக்கு அப்படினு பார்த்தோம்னா அந்த இடத்துல நமக்கு எந்த ஒரு latency periodம் இருக்காது. So next one synaptic disorder plus muscle atrophy இருக்கு அப்படினு பார்த்தோம்னா நம்ம இந்த nerve conduction study side நம்ம கிளியர் பண்ண மாட்டோம் இல்லையா? So answer என்ன அப்படினு பார்த்தோம்னா demyelinating disorders. So third question, which of the following factors does not affect nerve conduction velocity? So here we want to express the factors affecting nerve conduction velocity. Factors affecting nerve conduction velocity அப்படினா என்ன அப்படினு பார்த்தோம்னா basically two types of the factors. So first one, physiological factor and technical factor. So physiological factor அப்படினு பார்த்தோம்னா that is the patient circuit, and technical factor அப்படினு பார்த்தோம்னா that is the machinery circuit. So என்னென்ன factors in the nerve conduction velocity affect பண்ணுது அப்படினு பார்த்தோம்னா இங்க நமக்கு age, gender, upper limb versus lower limb plus temperature. So இந்த இடத்துல நமக்கு age அப்படினு பாக்கும்போது during the childhood level or adulthood levelல nerve conduction ஓட capacity increased இருக்கும். So once நம்ம adulthood cross பண்றோம் அப்படினு பார்த்தோம் அப்படினா nerve conduction velocity reduce ஆயிட்டே போயிட்டு இருக்கும். So age is the wrong answer. Next one, temperature. So temperature low-ஆ இருக்கு அப்படினு பார்த்தோம்னா nerve conduction velocity low-ஆ இருக்கும். Plus temperature increased இருக்கு அப்படினு பார்த்தோம்னா nerve conduction velocity increased இருக்கும். The question என்ன அப்படினு பார்த்தோம்னா எந்த factor nerve conduction velocity-ய affect பண்ணாது is the question. So இதுவும் affect பண்ணும், இதுவும் affect பண்ணும். Next one is the gender. So gender அப்படினு பார்த்தோம்னா there are both the female and male. The circumference of the muscle plus upper limbs were going to get reduced to the females compared to males. So the gender also going to get affecting one of the factor over the nerve conduction velocity. So except என்ன answer இருக்கு அப்படினு பார்த்தோம்னா muscle mass is the answer. Next one, which of the following condition can be diagnosed using the nerve conduction study? So nerve conduction study நாம எதுக்கு யூஸ் பண்றோம் அப்படினு பார்த்தோம்னா demyelinating disorder. So இதுல demyelinating disorders அப்படினு பார்த்தோம்னா Guillain-Barré syndrome is the only answer. Next one, in diadynamic current, which of the following frequency bands generally used for the muscle contraction and pain relief? So muscle contraction and pain relief அப்படினு பார்த்தோம்னா so simple answer என்ன அப்படினு பார்த்தோம்னா so diadynamic current அப்படினு கொடுத்தது என்ன அப்படினு பார்த்தோம்னா diadynamic currents one of the low frequency modality. So based on that we'll choose the options here. A patient with acute pain following the muscle strain treated using low frequency TENS. So low frequency TENS அப்படினா என்னது? Which type of the TENS? That is the acupuncture type of the TENS. And what is the optimal frequency for this ischemic to reducing the pain? So exactly that is the 80 to 100 hertz of the frequency. So during low frequency TENS treatment, the pulse width typically ranges from low frequency TENS ஓட pulse width தான் கேக்குறாங்க. That is 100 to 300 μs. Next one, low frequency current. அதாவது low frequency அப்படினு பார்த்தோம்னா அதோட frequency level 1 to 100 hertz தான் இருக்கும். So that is the low frequency are primarily used into the electrotherapy for which of the following therapeutic uses? So low frequency அப்படினு பார்த்தோம்னாவே மசிலை ஸ்டிமுலேட் பண்ற அந்த மசில் ஸ்டிமுலேட்டர் தான் சொல்றாங்க. So muscle stimulator அப்படினா motor point ஸ்டிமுலேட் பண்ணும். So மத்த ஆப்ஷன்ல பெயின் ரிலீஃபிங் இருக்கும், டிஷ்யூ ஹீலிங் இருக்கும், பிளஸ் சென்சரி ஃபைபர்ஸ் ப்ரோமோட்டிங் இருக்கும். So சென்சரி ஃபைபர்ஸ் ஸ்டிமுலேட் பண்றதுக்கு, பெயின் ரிலீஃப் பண்றதுக்கு, பிளஸ் டிஷ்யூ ஹீல் பண்றதுக்கு எல்லாத்துக்குமே மீடியம் ஃப்ரீக்வன்சி கரண்ட் யூஸ் பண்ணுவாங்க. So லோ ஃப்ரீக்வன்சில மெயின்லி மோட்டார் ஸ்டிமுலேஷனுக்காக மட்டும் தான் யூஸ் பண்ணுவாங்க. So ஆப்ஷன் A is the correct answer. Which low frequency TENS treatment is most effective for acute pain relief using the gate control theory? So எந்த TENSல எந்த frequency level கரெக்டா இருக்கு அப்படினு பார்த்தோம்னா 80 to 120 hertz with short pulse duration is the right answer. In iontophoresis, which of the following ions are most commonly used for inflammation reductions? So inflammation கம்மி பண்றதுக்காக எந்த டைப் ஆஃப் மெடிசனை iontophoresisல யூஸ் பண்றோம்ங்கிறது question. The answer is dexamethasone. a physiotherapist is using iontophoresis with dexamethasone to treat a patient for inflammations. So where we are going to place the dexamethasone medicine? So எந்த எலக்ட்ரோட மெடிசன்ல நம்ம பிளேஸ் பண்ணுவோம் அப்படின்னா iontophoresis related questions. The answer is நெகட்டிவ் எலக்ட்ரோட். ஸோ இன்கேஸ் நெகட்டிவ் எலக்ட்ரோட்ல ஏதாவது லோக்கல் கான்ட்ரா இண்டிகேஷன்ஸ் இருக்கு அப்படின்னு பார்த்தோம்னா பாசிட்டிவ் எலக்ட்ரோட்ல பிளேஸ் பண்ணுவாங்க. அந்த பிளேஸ் பண்ற எஃபெக்ட்டுக்கு என்ன பேரு அப்படின்னு பார்த்தோம்னா பிளாசிபோ எஃபெக்ட். What is the effect? That is the placebo effect. In iontophoresis, which of the following medication is most commonly used for pain management in the musculoskeletal injury? The answer is lidocaine. So what is the typical current intensity used in iontophoresis for delivering medication? That is 1 to 2 milliampere. ஸோ சூப்பர்ஃபிஷியலாக தான் நம்ம பெனிட்ரேட் பண்ணுவோம். ஸோ 1 to 2 milliampere மட்டும்தான் நமக்கு சூப்பர்ஃபிஷியலா இருக்கும். ஸோ மற்ற ஆப்ஷன்ஸ் எல்லாமே டீப்பா போயிடும். ஸோ சூப்பர்ஃபிஷியல்ல மட்டும்தான் நம்ம iontophoresisல டெலிவர் பண்ணுவோம். ஸோ இன்கேஸ் டீப்பா போகுது அப்படின்னு பார்த்தோம்னா குட்டேனியஸ் சர்க்குலேஷன்ல due to cutaneous circulation the drug will be delivered to all over the body. நம்ம சூப்பர்ஃபிஷியலா மட்டும்தான் ட்ரக் டெலிவர் பண்ணுவோம். ஸோ சூப்பர்ஃபிஷியல் எஃபெக்ட் அப்படின்னு பார்த்தோம்னா 1 to 2 milliampere. High voltage pulsed galvanic stimulation is primarily used for which of the following purpose in the physiotherapy? So wound healing plus tissue repair காக மட்டும்தான் நம்ம high voltage pulsed galvanic current யூஸ் பண்ணுவோம். ஸோ மற்ற டைப் ஆஃப் கரண்ட்டுக்கு நம்ம பெயின் ரிலீவிங் பிளஸ் ரேஞ்ச் ஆஃப் மோஷன் இன்க்ரீஸ்க்கு மசில் ஸ்ட்ரென்தனிங் எல்லாத்துக்குமே நம்ம ஹை வோல்டேஜ் பல்ஸ் நம்ம யூஸ் பண்ண மாட்டோம். ஸோ ஒன்லி wound healingக்கும் டிஷ்யூ ரிப்பேருக்காக மட்டும்தான் நம்ம ஹை வோல்டேஜ் பல்ஸ்ட் galvanic current யூஸ் பண்ணுவோம். ஓகே, thank you. And if you have any queries, list out your queries in our comment box. We'll reply soon. Thank you.